This section we're going to talk about a little bit about cosmetic dentistry. We're going to get into a little bit more fun stuff here. Cosmetic dentistry basically includes a variety of dental treatments aimed at improving someone's appearance, okay, appearance of teeth. In our practice, we utilize the principles of cosmetic dentistry in everything we do, whether it's building dentures, partials, implants, veneers, crowns, and so forth, and even extractions and root canals, okay? When we do extractions in our office, we take into consideration that there will be bone loss, and it will affect the facial structures and aesthetically the gums and so forth. So we add bone, we add membrane, we do grafting. So that is a little bit of a difference when someone has had extensive training in cosmetic dentistry. That way they can basically try to incorporate all those principles in whatever it is that they do. Some of the most common procedures that patients know about are crowns, veneers, in cosmetic dentistry, Invisalign, 6 months orthodontics that Dr. Chin will be covering here. No matter what we do for a patient, whether it's dentures, implants, or anything, the first thing that must happen is every case must start with a smile design or the blueprint. Again, this is one of the most skipped areas in dentistry. When a dentist sees you, they jump into treating you and giving you a solution rather than really studying it, okay? Now, for whatever reason that is, either the dentist has not been trained this way or has not kept up with the training, or the fact that, you know, your insurance company is saying, you know, don't do this way, because there is cost involved in designing a case. However, it's the best way, because what we basically do is we sit down with every patient and we want to understand exactly what is it they're after. Cosmetically, functionally, aesthetically, what is it that they're after, okay? One of the important things is that I discuss with patients right at that appointment, whatever we do, is really what is your budget. See, dentistry is very much like, you know, constructing a home or a building. So when you go to an architect, the architect wants you to know, do you want to build a 1,200 square foot home? Do you want to remodel it? Or do you want to have a 5,000, 6,000, 7,000 square foot mansion? What is it that you want? What is your budget? Is your budget for travertine or linoleum or hardwood floor? Well, the same thing is in dentistry. For every budget, there is a treatment. It's not that, you know, everything has to be so expensive, but you have to have really a realistic budget when you go and see your dentist, and really try to, you know, be very open with your dentist. Tell them, you know what, my budget is $5,000, but I can go up maybe to $8,000, but I like to stay around $3,000, okay? Something like this. So he has a range he can work with. It's very, very difficult to sit down, spend time with the dentist, and then at the end just be blown away with the numbers, because he has no idea of what really your budget is. So one of the things that we suggest is, you know, if we have it, actually, if you go to our website under the page for payments and fees, there are two companies called CareCredit and Springstone. A lot of the treatments now can be financed with no interest or with interest on a longer term plan. You can plug some numbers in and see what works in your monthly budget and how it works out, and have some sort of idea before you go and see the dentist there, okay? So one of the things that we have, it's called a smile catalog, and there are different smile catalogs out there, but it's something that we certainly use in our practice for pretty much every patient. This smile catalog basically comes with about 12 different styles of teeth that basically shows a different variations in length of teeth, the size, the smoothness around the corners of the teeth, and how those front 8 to 10 teeth can look like, okay? A patient, for example, they may look at something that may look perfect, but then we point out to them that you don't want it to look machine-made, okay? I think that's one of the reasons that a lot of people say, you know, veneers look fake or crowns look fake and so forth. I think there was no communication between the patient and the dentist to figure out exactly what it is that the patient wants to do, okay? So we sit down, we go through that, and then we basically, the next step, again, like an architect, where you take the blueprint, you're drawing, and it's a 2D drawing, and you send it to a CAD/CAM lab to do a 3D drawing. We send it to our lab, and we have them do a 3-dimensional wax-up, diagnostic wax-up of what things should look like. So this particular patient that came in, she basically, as you can see, she has a very wide smile. Very much like Julia Roberts, maybe. Huge. You can see her teeth all the way to the back of her ears. So again, the question was, what do you want to do? How much wider do you want to go with the color of the teeth and so forth? And she said, I definitely want to go much wider. So we had to basically almost do a full mouth or upper reconstruction for her, extending all the way from the front to the back and covering everything for her, okay? This particular patient, Betsy, she came to my office on a Monday morning. She's a mother of a Olympic champion, and her daughter was getting married, and she told me that, you know, my daughter said the in-laws' teeth all look perfect. Mine doesn't look too good, so my daughter wants you to do something for me. So it was Monday morning, and we went to work. So by Friday afternoon, 5 p.m., we had her mouth reconstructed, and she had a full mouth reconstruction done, okay? Those are all combinations of veneers and crowns and so forth. 28 teeth involved.